Hi, I'm Katie from Komen, and today I'm going to talk to you a little bit about nail care. Nail care is very important anytime, but definitely while you're going through chemotherapy. You may notice that your nails change, that they start to become brittle, dry, or sore, and that is because chemotherapy is designed to target any fast-growing cells. So it kills the bad stuff, but sometimes it kills the good stuff too. So today I'm going to give you a couple little tips, tricks, how to maintain your nails through chemo treatment and even post-chemo to look good and feel good. So we're going to start with taking care and manicuring your nails. So you want to start with a gentle nail polish remover that does not have acetone in it or any other harsh chemicals. You can get that at your drugstore, no problem. So we'll want to remove any existing polish. And this is also a great time to moisturize and just kind of relax and pamper and get those cuticles soft before you really get started. So I've got some hand cream, some cuticle cream, and also some Sally Hansen nail and cuticle oil, softening everything up. Anything you can do without cutting is great. Anytime you cut, you run the risk of infection. So if you can do anything without snipping or cutting anything, that's great. So once you do all of that, what I would do is put on these awesome little moisturizing gloves that you can just relax for like 15 to 20 minutes to really soften everything up and move on to your next step. So if you are going to do any trimming or cutting, it might be a good idea to do an at-home kit. So I've got this great little set from Revlon that's got your nail file and little nail clippers, and this is also good for traveling. Always check with your doctor. They'll be able to give you the best recommendations, but it's typically advised to not go get a mani or pedi while going through treatment, or at least at certain times during your treatment. Your immune system may be lower, and just even a quick little snip or cut could cause an infection, which puts you at higher risk for lots of things. And nobody wants to go to the emergency room because they had a little cut on their finger. So we've got that. You can also do some buffing and shining and a little scrub brush to really clean underneath those nails and make sure everything is out from underneath there. Again, just staying healthy and clean. Once you've done all of that, we can move on to the polish. I love this one. This is Sally Hansen Nail Nutrition. It is both a base and top coat. So this is a strengthener. I think it's great to use anything with a strengthener in it, because again, your nails may become a little more brittle. They may not, but anyways, put a nail strengthener on first, and then you can put any polish on. Put a couple coats and then go back with the nail strengthener. That's gonna be a great top coat and seal everything in. This is a great time to play with glitter polish. Glitter, I have a love-hate relationship with it. It is so hard to get off, which is kind of why it's good to wear it at this time. It's going to stay on for a very long time. It also adds a whole nother layer of strength. That glitter is very strong on your nails. So this is a great time to play with it. I didn't let it bother me. When it would start to fall off, I would just go to my gentle remover and go back on with another coat and kept that on. Again, with any of these things, we advise that you check with your doctor and see what's gonna work the best. There are some nail polishes that have magnetizing chemicals and compounds in there. Those you'll want to be careful of, especially if you're getting PET scans or MRIs, because you can't go into those machines with those chemicals in the nail polish. Most of them don't, but just double check. So hopefully you enjoyed these. These are great things to treat yourself to for a little pick-me-up, but these also make great gifts. So if your loved one is going through a tough time, this is a way you can cheer her up and pamper her.